Enterococcus in Graft-versus-Host Disease. Definition: Graft-versus-Host disease is a life-threatening complication that can be successful after bone marrow or stem cell transplant.
My name is John Galvin. I'm one of the stem cell transplant doctors. My role is to see patients prior to transplant, help them through transplant, and afterwards as well to help manage any type of complication. GVHD is a complication that can happen after transplant. It stands for Graft-versus-Host Disease. The graft is a fancy word for donor cells, and the host is the patient cells. After the donor cells find their way and grow in the host or the patient, they can start attacking the host in places that it shouldn't be attacking.
I was aware of that GVHD may happen. I didn't know exactly what could happen to me. That's why I was watching closely to all the new symptoms that I was developing.
So graft-versus-host disease likes to attack certain parts of the body.
Application in nursing: controlled vital sign, medicine administration of high dose of cyclophosphamide after transplantation, maintaining the patient with total parental nutrition.
You mentioned what had been I guess, the really bad thing that people that transplant physicians worry about, this graft-versus-host disease. That's where your transplant essentially tries to reject you because it's your immune system. You've got a new immune system, right? I always thought that a little bit of graft-versus-host was probably a good thing, so you don't necessarily want a super perfect match. Is that fair, or has that thinking changed?
This is actually one of the most controversial areas in transplants today. So for the rare individual who has an identical twin, most of us would recommend a twin transplant. You're getting a pure product which has no contamination of cancer cells, and which there is a very almost no.
Pros and cons. Pros: graft-versus-host disease does not occur when the person receives their own cell. Cons: it causes disorder of the gastrointestinal tract involvement.
There are many products that are now sitting on the shelf of a laboratory that have the potential to cure many incurable diseases. So the Center for Definitive and Curative Medicine wants to bridge these two words and bring them together to cure patients with incurable diseases. So when we do stem cell therapy, the drugs we give today shut off the immune system. They don't shut off only the response to the stem cell. They shut off everything. So they expose the patient to a tremendous risk of infection. So the idea is to give cells that will specifically shut off the immune response to the stem cells and keep intact the immune response that we need to protect ourselves against viruses or bacteria or other pathogens. My team discovered one group of these T regulatory cells which
Agency supply in Ecuador. In Ecuador, the only institution to perform this procedure today is the Dr. Juan Tancamarengo Cancer Institute in the city of Guayaquil. This disease has a great impact on the national economy. Reports report that by 2015, only 35% of low-income countries had pathology service, and less than 30% offer correct treatment.
Mesenchymal lineage adult stem cells, MLCs, are rare and potent cells that play vital roles in maintaining health and respond to signals associated with tissue damage. MLCs are taken from healthy young adult donors from various tissue sources, including bone marrow. MLCs are isolated and expanded to create master cell banks, which generate thousands of readily available therapeutic doses for use in patients without the need for tissue matching, resulting in an off-the-shelf product that potentially will be available on demand. Each product is packaged into vials, frozen, and then transported to medical facilities for potential use in patients in clinical trials worldwide. Mesoblast is targeting a broad range of diseases with high unmet medical needs, including advanced heart failure, chronic low back pain due to disc degeneration.
Conclusion: Graft-versus-Host disease can occur any time after transplant. However, it is more common after the bone marrow begins to produce healthy cells.
As you learn about or plan for a blood or marrow transplant, your transplant team will help you learn about GVHD. GVHD stands for Graft-versus-Host Disease. Learning about GVHD and knowing the signs and symptoms to watch for can help you be more prepared for your transplant recovery. What is GVHD? GVHD is a common side effect of an allogeneic transplant. An allogeneic transplant uses healthy blood-forming cells, also called stem cells, donated by someone else. GVHD develops when your new donated cells do not recognize your body, and as a result, your body is attacked by your new cells.